Doesn't look like, thank you, Andrea. It doesn't look like we're having a lot of more people join quickly right now. So we'll go ahead and get started. My name is Suzanne Wilson. I'm the director of the Division of STD, HIV, Hepatitis, and Tuberculosis here at the Bureau for Public Health. And we will get started this afternoon with our June Kanawha County HIV Task Force update meeting. So I'll start by providing the most recent EPI update. And I will share my screen. Okay, can you guys see the slides?
Yep.
Somebody? Okay, great, thank you. All right, so maybe if the slides want to advance, there they go. The current outbreak data reflects an increase of 2 new HIV diagnoses from the last time that we met in April, bringing the total to 106 cases that have been new cases that have been identified since January 1st of 2019. Both the new cases were diagnosed in the hospital, and currently 9 of the 10 cases that have been identified in 2022 in Kanawha County have been confirmed to be associated with injection drug use. And just as always, I think most everybody on this call knows, but these data indicate or are representative of cases, new HIV diagnoses where the individual reports either being homeless or having a resident address in Kanawha County. So the epidemiology of the outbreak has remained pretty much the same as we've been seeing. There are still slightly more male cases than female at 57%. Almost 80% of the cases are between the ages of 20 and 40. And 54% of the cases report being homeless or unstably housed in the past 12 months. 92% of the cases current cases are co-infected with hepatitis C, and hospitals do remain the setting where the largest number of cases have been identified at 42%. We do have, we had 1 new case that was deceased. However, it's not suspected that that death is related to their HIV status, but we don't have an official cause of death for that yet, so that investigation is still pending. Looking at the medical status of the Kanawha County outbreak cases, all categories continue to move in a positive direction with increases in each one. The number of individuals that have ever been linked to care at some point since their diagnosis has increased by 5 over the last 2 months, from 86 to 91. And 2 of those 5 individuals being linked to care within 30 days of their diagnosis. As always, our goal is for individuals to be virally suppressed to protect their own health and prevent the spread of disease. And we do have an increase of 1 individual who achieved viral suppression since our last meeting. As a reminder, you can find statewide data and information and other information on our on testing and care resources and training opportunities on the HIV Aware WV.org website. So does anyone have any questions about the EPI update or the data before we move on to other updates? Okay, great. While I have the floor, I'll go ahead and give just a couple of other quick program updates. We have filled the vacant or the new DIS positions for Kanawha County. So we now are the Region 1, which encompasses Kanawha County. The third DIS for that position has just started and has begun training. So we have two DIS that are currently trained and working cases in Region 1, and the third one has just been brought on board and has begun her training. So we are excited to now have the additional support for HIV and STD investigations in the area. We have also, our HIV prevention group has also begun doing outreach testing again, and now that the weather has finally cooperating, and so there's been several, there's been events held. They've been attending a lot of the Pride events in Charleston as well as around the state, and other outreach testing events are on the schedule and posted on the website. So at that, I'll move on to some partner updates. Let's see who I see here to start. I see Cassie. I see you. Do you have any updates from Covenant House?
I do. I have a few. So
Okay.
we have another person here. Oh, you can't see her because it's blurred. Hold on. That's Summer. Summer is our new peer support person. So she's working directly with our HOPWA clients. So it's directly with the cluster clients to get them into care and to get them the support they need to actually get into care. So that's a plus. She just started last 2 weeks ago, so I'm still training. We'll be doing outreach for the next 2 or 3 weeks, and then she'll be on her own. But this is for anybody in our cluster population that needs pretty much anything for the first 6 weeks of their diagnosis is the way we're doing it, or the first 6 weeks of care. So, and then got a little conversation going on with y'all. Hopefully we get to house a DIS person here. I'm hoping that would be a great benefit for us both. Working with the federal DIS we worked with, we were able to find a lot of people just using all of our resources. I think that will help tremendously. Other than that, just trying to keep the people we do have housed, and looking for everybody else that we need to get. Of course, we've been out testing with y'all and a couple other organizations. We did a good event in Dunbar. We didn't find any HIV in Dunbar, which is a plus. There was a whole lot of hepatitis though. So we're hoping that we can get HIV testing going down there more, hopefully monthly here in the next few weeks, get that started. But other than that, that's all we got going on. Our added help is very much needed and appreciated. So, and if y'all need me, just give me a call.
All right, great, thank you. I believe I saw, well, I don't see her now. I thought I saw Rhonda earlier from Health Right. Rhonda, are you on?
I am.
Okay. Oh, there you are.
Bear with me. We just barely got our internet back up. We've had no internet all morning. So needless to say, we've been trying to see patients on paper, old school style. So it's been a mess because, you know, we're all spoiled with the internet.
Yeah.
So our outreach team is out and we've added some Saturday events as well coming up in July, and there's some Sunday events that I'll post later that will be at West Virginia State University. So we've got a contract with them now, so we'll go down there and do testing and vaccines on site. So that's a new area that we can hit. In April, we tested 102 on outreach, and we had 3 that were positive, known positives that were lost to care that we got back into care with Ryan White. One of the good things is that Dr. Christine Teague is out with us on Tuesday afternoons on the west side. She has a crew over there. So while we're testing, if there's an issue or something, they're right there and can take them immediately and get them into care. And that seems to be working out really well. Because a lot of times when we say we're going to take you here or there, you know, they'll run. This way, you know, we're getting them into care the very same day. We also have the Biktarvy on the mobile unit as well. And for those that are negative, we have PrEP, and we're soon going to get the injectable PrEP that's in the works, so that we'll be able to carry that on the mobile unit, which will be very nice. May, we tested 127 on outreach for HIV. And as Kathy said, we have noticed as well an increase in Hep C, the ones that are coming through, because I was kind of shocked last month, the number of who was negative and who was positive. So that is on the rise again, unfortunately.
All right, great. Thank you. Anybody have any
Thanks.
questions for Rhonda before we let her off the hook?
I'll still be here if you do. I'm playing catch up on my computer.
I'm sure, yeah. All right, thanks, Rhonda.
Thanks.
And hi, Kelly, did you have, I see Kelly on, do you have any updates from OFLAC or syringe service programs?
Oh, hello. Yes, we have one new program who has applied. They haven't been approved yet. We have some outstanding questions for them, but they are will be located in Wyoming County, serving the Oceana area with a mobile syringe service program. So that's in the southern part of the state. So we were happy to get that, and hopefully we'll get the questions that we have for them answered and get them licensed very soon. So that's really the only new news that we have. We still haven't had any complaints that we've had to investigate. So that's good. And we're just hoping to grow even more. Wyoming County's program would make us 15 licensed syringe service programs.
Okay, great. Thank you, Kelly.
You're welcome.
I see, it doesn't look like Christine was able to join us, but I see Brooke. Do you have any updates from Ron White?
Yeah, hey, I do.
Okay, great.
So we've been, like Rhonda said, we've been going out with Health Right and teaming up with them on the West Side one day a week. And I can't say how much it's helped to have another medical clinic with us. It gives us a little bit of cover instead of just being an HIV provider sitting in a parking lot, and we can only serve people that are known to us. It's helped so much. I can't even say how grateful we are for that partnership. And I also teamed up with Cabin Creek Health Systems, and they're coming with us to City Park every Monday afternoon. It's been a couple of weeks in a row now that we've been able to set up there. And again, it's the same thing, like being able to advertise it as just low barrier medical care. And then we can have those individual conversations with people as we're learning about their risk factors. Helps tremendously. It's so much, that feels like a lot of progress. And so we've been starting to do outreach to, the Kanawha City area is always on our radar. Campbell's Creek, Rand, we had our first positives in Marmette a few weeks ago. And so making connections out in those spaces and taking it's just me and my peer recovery coach going out with our backpacks. We don't take the van out really because again, it's strange to roll up in a big medical van and only be able to provide HIV care. So we've just been doing a lot of street outreach and testing. We've gotten down to Wyoming County once a month since probably March. And that's, again, been really useful, just making connections and networking with professionals that are down there and the service providers, but also just doing the same methods of outreach. We just go around with backpacks and HIV tests. And I think that's pretty much it. We're continuing. Boone County, we were able to get out to Boone County and Logan County this month also. So That's what we have. And it has been really we have Shauna Walker's our PA. She sits on the van with us on Tuesdays, and having one of our HIV providers there on site, she can address any of the wounds that might come up, any new diagnosis, and of course all the ones that we've had lost to care. It's really facilitated an increase in our linkage to care numbers, especially ones that we had lost to care. So that's all.
Great, thank you.
Mhm.
All right, and then I guess I see Jeanette or Sarah from the Mid-Atlantic AIDS Training Center. Do you guys have any updates you'd like to provide? It's okay if you didn't. I don't mean to put you on the spot. I just see you guys are on here, so.
No, that's all right. Can you hear me okay, Suzanne?
Yeah, sure can.
Okay, perfect. So we have been working with the West Virginia Primary Care Association, and we are actually hosting a PrEP webinar, including injectable PrEP. The next session is June 23rd with Kaylee Berner. She's an infectious disease nurse practitioner at WVU. So registration is free, CME is free, and CME is also free and offered through the Primary Care Association. The registration is located for that event on their website. But other than that webinar that's coming up, we've just been networking with providers in the Huntington and Charleston area for the last several months, just to talk about testing and PrEP. And we're more than happy to collaborate with more events with the GHHR.
We're all.
Great. Yeah, thank you, Sarah. I will, I'll reach out and make sure that we get that link to the Primary Care Association's page and information on that training put on our webpage as well. Okay, I don't see, is there any other organization or partner that I've missed? I'm trying to do a quick scan, but there's a lot of names on the screen. Or anyone have any other updates to share with the group? Okay, or any questions? Okay, great. Thank you, Sarah. And Sarah has put the link to the training in the chat. If anybody would like to grab that. And thank you, Sarah. Yeah, I'll make sure we get a link to that put on our website as well.
Suzanne,
Uh-huh.
yeah, I do have a question in the sense that, you know, when you look at the epi data, Huntington area is growing significantly compared to actually Kanawha County. Is there going to be a task force established for that?
So that would be a question for Dr. Kilkenny and the Cabell County Health Department. This particular task force is actually a local task force that was originated by Canal Charleston Health Department and is really theirs, and just we kind of took over the facilitation of it during the transition when Dr. Young, you know, resigned as their health officer, and their new health officers getting on board and whatever, and so that it'll be you know, sort of transitioned back to them now that they're getting restaffed with the new health officer and a new director of operations. So that I know they are in Cabell County. They have begun reinstituting several of the activities, their response activities that they did previously in 2019, but that would really But for the specifics of that, I'd direct you to reach out to Cabell Huntington Health Department.
Okay.
Okay, well, if there are no other questions or updates, thank you everyone for your time and all the great work that's going on out in the community. And hope you have a great afternoon, and we'll talk to everyone soon.
Thank you.
Thanks.